Hello, and welcome to Infection Prevention Training for all staff. My name is Missy Travis, and I'm one of the infection preventionists in the Healthcare Associated Infections Program at the Tennessee Department of Health. Today, we are going to cover some basic infection prevention principles in the healthcare setting. We will be using some educational materials from the Centers for Disease Control and Prevention, including Project First Line. We will also be referencing some site-specific information. So let's get started with your training. This is the agenda for our time together today. We will be discussing hand hygiene, personal protective equipment, environmental cleaning and disinfection, and respiratory hygiene cough etiquette, otherwise known as source control. Here is what we expect to learn today. By the end of today's training, you will be able to describe 2 reasons why having clean hands is especially important in healthcare, discuss 2 reasons why hands are the main way that germs can spread in the environment, define PPE and describe 2 functions of PPE in healthcare, discuss 2 reasons why wearing more than 1 pair of gloves at once is not recommended for routine care, discuss why it is important to follow the label instructions on a disinfectant product, describe the difference between cleaning and disinfection, and explain how respiratory hygiene cough etiquette, otherwise known as source control, keeps germs from spreading. Let's start with one of the most important practices in infection prevention, hand hygiene. I know what you are thinking. What could I possibly learn more about hand hygiene? I know, we talk about it a lot. The reason is because we know that it is very important, and we also know that it is not always done appropriately. Did you know that appropriate hand hygiene prevents up to 50% of avoidable infections acquired during healthcare delivery, including those affecting the healthcare workforce? Before we get started, let's review a definition of hand hygiene. Go ahead and read the definition to yourself. We talk about the term hand hygiene, but the simpler way to say it is just cleaning your hands and not washing your hands. It's because hand hygiene includes washing your hands with soap and water and using alcohol-based hand sanitizer. Germs are everywhere, and we can spread them without even knowing it to other surfaces, things, and people. In healthcare, you are likely to come in contact with things that carry germs, like respiratory droplets, saliva, blood, and waste, and you're more likely to touch patients at risk for bad infections. In this graphic, we see a patient who is ill and coughing with respiratory droplets traveling into the air and landing on surfaces, where the healthcare worker picks them up with her hands and unfortunately carries the germs to her eyes. The healthcare worker could also easily carry the germs to her nose or mouth while or after removing her mask. As a quick reminder, if we touch something that has germs on it with our hands and then touch our eyes, mouth, or nose without cleaning our hands first, we could get sick. If we touch something with germs on it and then touch something else without cleaning our hands first, we can spread germs that can be picked up by someone else. This is how a lot of germs get spread in healthcare, not just viruses. That's why cleaning our hands is such an important part of infection control and prevention. Let's watch this quick video from the CDC that describes how to properly wash your hands.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
Now, let's watch a short video from WHO, or the World Health Organization, to demonstrate the proper way to use alcohol-based hand rub. Remember, hand sanitizer should always include at least 60% alcohol. You do not want to use hand sanitizer when hands are visibly dirty.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
For each of the infection prevention practices we discuss, we will also talk about the specific actions required in the healthcare setting. For hand hygiene, this includes performing it at the appropriate time. So let's review each one. So you should use either an alcohol-based hand rub or wash your hands with soap and water immediately before touching a patient, before performing an aseptic task or handling invasive medical devices, Before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and after glove removal. Keep in mind that wearing gloves does not take the place of hand hygiene. So even if you are wearing gloves, it is still very important that you perform hand hygiene before putting your gloves on and after removing your gloves. Now that we have covered hand hygiene, let's move on to personal protective equipment, or PPE. Let's start by discussing how PPE works. PPE has two distinct functions. It protects you from the environment, but it also protects the environment and others from you. It is important to remember that PPE is not 100% effective. It is intended to be used as a barrier and is only one of the infection prevention strategies. For PPE to work, you have to use it correctly. For example, if your gloves are too big or too small, they will not create the most effective barrier. Likewise, a mask that does not fit snugly to your face is not likely to protect you as well as a well-fitted mask. Now, let's move on to another piece of personal protective equipment, gloves. As we discussed with all PPE, gloves must be worn properly or they won't be effective. It's also important to note that gloves do not replace cleaning your hands. So when should you clean your hands? Before and after you remove your gloves. It's important to clean your hands after you remove your used gloves and before you pull a new pair out of the box. Why? Because if you reach into the box with dirty hands, what happens? Well, typically more than 2 gloves comes out and you end up having to put those extra gloves back into the box. Whenever you do that, you will contaminate all the other gloves in the box if your hands are contaminated. Wearing more than one pair of gloves can make it harder to move your hands and fingers while providing care, which can lead to mistakes. Also, removing and replacing the top layer of gloves between patients or tasks increases your risk of contaminating the bottom pair of gloves and spreading germs to yourself, others, and the environment. Let's watch this short video that demonstrates how to properly remove gloves. Now that we know how to remove gloves, let's watch another short video from CDC to demonstrate the proper way to put on or don and take off or doff our masks to limit the spread of germs.
Know how to wear your face mask correctly. First, wash your hands with soap and water for at least 20 seconds or use hand sanitizer that contains at least 60% alcohol. Put your face mask over your nose and mouth and secure it under your chin. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Make sure you can breathe easily. Remove your mask carefully. Untie the straps or unhook the loops from your ears and pull the mask away from your face without touching the front of your mask. Don't touch your eyes, nose, or mouth when taking off your mask. Wash your hands for at least 20 seconds immediately after removing your mask, or use hand sanitizer that contains at least 60% alcohol. Learn more at cdc.gov/coronavirus and coronavirus.gov.
This is a helpful infographic that demonstrates how to take off your mask correctly. Note that you always want to reach for the cleanest part of PPE that you are removing. In this case, it would be the ear loops or the ties. Also notice that you are folding it so that the inside is the part you are touching. While you may have contaminated the inside with your own breath, the outside would be most contaminated with germs from other people. For PPE competencies, we are looking for the proper selection and use. We also want to ensure that PPE is readily available for use when indicated. In addition, you should be putting on and taking off PPE like we discussed today and as demonstrated in the videos. 2 key tips is good fit and always reach for the cleanest part of the PPE. Now we are going to move on to respiratory hygiene, cough etiquette, otherwise known as source control. Source control is an important tool to keep germs from spreading. It stops germs at their source before they can be spread to other people, and that's where the name comes from. Let's review this definition of source control from CDC. Go ahead and read the definition to yourself. This definition specifically refers to source control for respiratory viruses. It focuses on covering the mouth and nose to keep respiratory droplets out of the air. That's right, wearing a mask for source control blocks your respiratory droplets from being released into the air. A mask should fit well without gaps at the edges and cover your nose and mouth. This is important because people who are infected with a respiratory virus have virus in their respiratory droplets that can spread to other people and the environment. We have been using source control for years to help control seasonal viruses such as the flu and other airborne illnesses such as tuberculosis, and it has been shown to be quite effective. Let's review some other key indications for respiratory hygiene and cough etiquette. These are infection preventions designed to limit the transmission of respiratory pathogens, as we discussed earlier. The strategies target primarily patients and individuals who are accompanying patients to the healthcare setting who may have undiagnosed respiratory infections, but also apply to anyone with signs and symptoms of an illness. It's important that we communicate to people coming into the healthcare setting that they are also responsible for practicing good source control by using respiratory hygiene and cough etiquette. This can be accomplished by having signs present at the entrances so that patients know that they should cover their mouth and nose when they're coughing or sneezing, also that they should throw any tissues away, and that they should perform hand hygiene anytime they touch their mouth or nose. Here are some other strategies to promote source control by using respiratory hygiene and cough etiquette. We want to make sure that we have tissues and trash cans that we can use to dispose of the tissues and contaminated masks. We also want to provide resources for performing hand hygiene, so this would include hand sanitizer or hand washing areas. Offer masks to symptomatic patients and visitors when they enter the healthcare setting. Provide space and encourage symptomatic patients to sit as far away from others as possible. Facilities may also wish to place these patients in a separate area if available while waiting for care. And then educate staff on the importance of prevention measures when examining and caring for patients with signs and symptoms of a respiratory infection. You may recognize the photo on the left. It reminds us why we care about blocking our respiratory droplets. You may also recognize the other picture. Our breath isn't just air. It has a lot of water in it. That's why our respiratory droplets, and they come out these are our respiratory droplets, and they come out every time we talk, sing, cough, breathe, or otherwise blow air out of our nose or mouth. Most of the time, they're so small we can't even see them, but they're there. When someone is infected with a respiratory illness, the droplets that they breathe out have virus particles in them. People who are close by can breathe the droplets in, or the droplets can land on their eyes, nose, or mouth, and they can get sick. Respiratory droplets can also fall on objects and surfaces and be picked up on someone's hands and spread that way. Wearing a mask can block respiratory droplets at the source and prevent the spread of virus. Source control is especially important for some respiratory illnesses because we don't always know who is infected, because people can be infected but not show any symptoms. That's called being asymptomatic. It matters because the virus can still spread from someone who is infected but doesn't feel sick. We have seen this with some of the respiratory viruses that are circulating in our communities right now. Wearing a mask that covers your mouth and nose can block your respiratory droplets from reaching others when you breathe, talk, sneeze, or cough. When it comes to wearing a mask, your mask should fit well without gaps at the edges and cover your mouth and nose. This makes it less likely that your respiratory droplets can reach people and things around you, as well as make it a source of protection for you. This is another infographic from CDC that demonstrates appropriate respiratory and cough etiquette. In terms of what to expect at your workplace, these are some of the competencies that will be used going forward to determine if you are meeting all the basic requirements to prevent respiratory illness, as we discussed in the prior slides. Next, let's talk about environmental cleaning and disinfection. First, let's take a closer look at an important part of disinfection, contact time. So what is contact time? Contact time, also called dwell time or wet time, is the amount of time a disinfectant needs to sit on a surface without being wiped away or disturbed to do its job of killing germs. Contact time is important because the product you're using might not kill germs right away. It takes time before all the germs are killed and something is truly disinfected. This time could vary depending on the product, but it is always specific and it should be on the label. Even if you're using a product that both cleans and disinfects all in one, it will still have a contact time that you need to use for it to work correctly. While you can usually judge if something is clean or not just by looking at it, this doesn't work with disinfection. Because germs are too small for us to see, we can't judge how well something has been disinfected just by looking at it. That's why the following instructions when you use disinfecting products is so important. First of all, in healthcare in the United States, you'll use disinfectants that are registered with the Environmental Protection Agency, or the EPA. The EPA is charged with reviewing chemicals used for disinfection to make sure that they're safe and effective. Disinfectants used in healthcare facilities will usually have hospital grade or something similar on the label. Other things you need to know are which surfaces the chemical can be used on, and which germs the chemical has been proven to kill, and whether the product should be diluted. That means if it needs to have water or another substance added to it to bring the concentration down so it's safe for use. If so, the label should tell you how to do that and what to use. And of course, the label will tell you the contact time or dwell time or wet time. The EPA has many resources about disinfectants for use in healthcare and lists of disinfectants that are effective against different germs, including all the respiratory viruses that you could see in a healthcare setting. You will notice that there is a list on the EPA website, and this is the list that we use for disinfectants that have been approved to kill SARS-CoV-2, or the virus that is responsible for causing COVID-19. But that is not the only list. There are lists for other organisms that you could see in the healthcare setting. This is what a list looks like after you have clicked on the link. You can find your disinfectant by either using the EPA number on the label or by the name. Let's look at a sample label. Here is a label of a disinfectant that might be used in one of the healthcare clinics. Let's look for the contact time and the EPA number. Do you see them on the label? Typically, the contact time is going to be over to the left right as you're looking down all the various instructions. And you'll also notice it's in that middle portion where it talks about 1 minute at the right under the main label. Notice it also describes what surfaces are compatible, how to store the product, etc. All of these details are an important part of the cleaning and disinfection process because if our disinfectant is not working properly, then it's not going to do the things that we want it to do. We know that we use disinfecting products at the right time and correctly, but what are some things that we shouldn't do? One of the biggest don'ts is don't rush the process. The entire contact time has to finish before something that has been disinfected can be used again, like shared equipment or before a new patient comes into a room after the last patient has been discharged. That's how we can be sure the disinfectant has had time to do its job and kill the germs. Don't try to dry a surface that's been disinfected more quickly by wiping with another cloth or by blowing on it with your breath. Also, don't blow air on the surface another way, like with a fan, unless the manufacturer of the product you're using says that that's okay. I once was working in an outbreak of an infectious disease in a healthcare facility, and we continued to have cases even though we had implemented several infection prevention measures and I was checking the rooms for cleanliness. One thing that I noticed in some of the rooms where we were finding new healthcare associated infections is that there was a particular housekeeper that was cleaning those rooms. And she was a very good housekeeper, and her rooms always looked very good visually. But I started watching her practice to see if I could notice that if there was anything that she was doing differently. And what I noticed is after she was cleaning the surfaces with the disinfectant, she was going back over it with a towel so that it would look nice and neat and clean. And so that provided an opportunity for me to educate her again about contact time, and that even though it might look nice, if we dry something off, you have to let it set for the complete time and let the disinfectant to dry. So this just reinforces that we need to be patient. We know that this can be tough. Patients may be waiting for rooms and equipment, and there may be pressure to move fast, but the risk of spreading germs is too great to rush the process. Following the instructions keeps germs from spreading and keeps your patients and coworkers safe. So let's talk about cleaning and disinfection and what the difference is between the two. Cleaning removes visible dirt, dust, spills, smears, and grime, including organic material like blood, as well as some germs from surfaces. It's important to clean before disinfecting because dirt and grime can make disinfectants not work as well. And we need disinfectants to work to kill germs on surfaces or objects. We've talked about the ways that cleaning and disinfection are part of our daily work life and how they work. Remember, cleaning is an important step because if we try to disinfect something that isn't clean, the disinfectant might not work, and we need disinfectants to kill germs. Now, let's take a few moments to talk about why this is so important in healthcare. It's important to keep the healthcare environment clean to stop germs from spreading. What are some places that you can think of that need to be cleaned and disinfected often? There are a lot in healthcare. Think about patient rooms. When a patient leaves a room or is discharged before a new patient goes into that room, it should be cleaned and disinfected to make sure germs don't spread. What about high-touch surfaces? We also clean and disinfect things that get touched a lot, such as bed rails, keyboards, and light switches. Those high-touch surfaces need frequent cleaning and disinfection. What else? It's important to clean and disinfect things in the healthcare setting that aren't touched or shared as often, but tend to be dirty and have a lot of germs on them, like toilet seats. One way we know that everyone is cleaning and disinfecting appropriately is to do competencies. Just as with the other concepts that we've discussed today, here is a list of the appropriate practices for environmental cleaning. Let's go through each one. So we know that we have routine and targeted cleaning of environmental surfaces as indicated by the level of patient contact and the degree of soiling. We want to clean and disinfect surfaces in close proximity to the patient and those frequently touched surfaces in the patient care environment at a more frequent schedule compared to other surfaces. We want to promptly clean and decontaminate spills of blood and other potentially infectious materials. We want to only use EPA registered disinfectants that have microbicidal activity against the pathogens most likely to contaminate the patient care environment. And remember, we find all that information on the label. And we want to follow manufacturer's instructions for the proper use of cleaning and disinfecting products. And then we want to make sure that everyone's engaged in environmental cleaning and that we're wearing the appropriate PPE to prevent exposure to infectious agents and chemicals. And at a minimum, gloves would be required when using your cleaners and disinfectants. Here are some of our key takeaways from today. As you know, healthcare workers touch a lot of things during their workday, so being diligent about hand hygiene is really important. For example, nursing staff touch up to 15 different surfaces during a single patient interaction. If you add that up, it's over 900 surfaces in an average 12-hour shift. Every one of those surfaces has germs on them, so it makes sense that cleaning your hands and using gloves correctly is very important. But even though we all know how important it is to clean our hands to keep germs from spreading, especially to our patients who may be at risk for infection, studies show that on average, healthcare providers clean their hands less than half of the time that they should. The other key takeaway is that some parts of the hand make it easier for germs to grow, like between fingers, under the fingernails, and in breaks in the skin, such as a rash or a cut. Viruses, bacteria, and fungi can all stick to your hands and be carried around the environment and spread to surfaces, devices, and people. So we need to be very careful to clean our hands and those parts in particular very well. PPE is important to protect both you and other people, but it has to be worn correctly for maximum protection. Also, multiple pairs is not recommended in most circumstances. We know that cleaning removes all of our visible dirt, and disinfecting is what kills germs on surfaces or objects. So both are important to ensure that we are killing all the organisms on a surface. It's important to keep the healthcare environment clean to stop the spread of germs. And then we also learned about respiratory hygiene and cough etiquette, otherwise known as source control, so that we can keep germs from spreading by stopping them at their source and also keeping them from spreading to other people. We also know that it is an important tool to reduce the spread of respiratory infections and diseases. We covered a lot today, and there is still more to learn. You can keep exploring these topics on your own using the resources on this slide. You can also follow CDC's Project First Line on social media. Did you know that there is an infection preventionist assigned to each region in Tennessee? There are. So depending on where you are located in the state, you can use this map to find the corresponding infection preventionists and their contact information. Please reach out to us with questions. This concludes our presentation on the basics of infection prevention. Thank you for joining me today, and I hope that this training has been helpful.